Hi guys, welcome. So go ahead and get settled in, get your flashcards. Just get comfortable. This shouldn't take too long. This is for my classmates in case you guys didn't know this, whoever's watching. But this is the second PowerPoint to Neoplasia, just a quick last minute video before the test tomorrow. Some of them have stars, some of them do not. But he did have some that were not star, and he said add a star. I didn't want to miss anything, so this is everything from that second PowerPoint. So we'll go ahead and get started. But yeah, definitely press pause, get settled in, get comfortable, because we're going to be studying and reviewing. So, okay, we ready? So, first question. For neoplasia to occur, what must happen? Well, we know what neoplasia is. It's new growth, right? So in order for there to be a new growth, what must happen? An irreversible change must take place in the cells, and this change is passed on to new cells. Well, we know that. So in order for neoplasia, in order for new growth to happen, we know that there must be something going on. Whenever there's a neoplasm, a tumor, and it becomes malignant, we know that we have the differentiated cells, and the cancer cells come in, and now it's kind of a bunch of different cells going crazy and stuff. So in order for there to be a new growth, we know that something must happen. We know that it is an irreversible change. Once they're there, it's not going to, you got to go under chemo, radiation. We know all this. So in order for neoplasia to occur, an irreversible change must happen to the cells, and then it's passed on to the new cells. An uncontrolled abnormal process. Okay? And the next one is, what is a synonym for tumor? We know that. We know what word is interchangeable with tumor. Neoplasm. Neoplasm is tumor. Tumor is neoplasm. All right. So I'm looking for 4 stages, okay? So this says give the stages from normal to cancer. 4 stages, okay? So the first stage is the normal epithelial cells, right? Normal cells. Second stage, hyperplasia. Remember, they start growing crazy. They keep multiplying a lot, rapid growth. Hyperplasia is second. Third, dysplasia. So then now they're losing their orientation and their differentiation. They're just going a little crazy. Everything's going on. And then fourth, cancer. So we have normal, hyperplasia, dysplasia, and then cancer. I shouldn't say that word so excited. Gosh. All right. So how do you name tumors? Easy. We know this. How do you name tumors? Well, we know there's a prefix and a suffix. So the prefix is the origin of the cell or tissue. That makes sense. We know this. Suffix for a tumor. Non-malignant, just a tumor. Oma. O-M-A. Oma. We know this. How do you name tumors? By a prefix and a suffix. Prefix is the origin of the cell or tissue, and the suffix, oma. We know this too. See, this isn't so bad. All right, what 3 types of epithelial tumors are found in the oral cavity? Let's see. So what 3 types of epithelial tumors are found in the oral cavity? We have squamous epithelium. We have a salivary gland epithelium. And we have odontogenic epithelium. This says what 3 type of epithelial tumors. I feel like these should have tumor on the end, but we're just going to know squamous epithelium. We know is all in the oral cavity, squamous cells. Squamous epithelium, salivary glands, and odontogenic epithelium. Odontogenic epithelium. We know what that is. That's, think of the dentin, those little odontoblasts and stuff like that. So squamous epithelium, salivary gland epithelium, odontogenic epithelium. How can we remember that? Epithelium, squamous, salivary, odontogenic. I got it. So the 3 types of epithelium that can, have tumors. SOS, somebody save us. Right? That SOS, help me, something's going on in my mouth. 3 types. Squamous Odontogenic salivary gland. SOS. Help. I need help. Help. Send help. SOS. Squamous epithelium, odontogenic epithelium, and salivary gland epithelium. SOS. Help. Okay. Now this is tumors of squamous epithelium. Okay, we know these. So squamous cell epithelium, we know that has a benign and then a malignant version, right? So both of those are on here. And it's epithelium. So anything malignant on this card is going to end in carcinoma, right? Carcinoma has to do with malignant tumors in the epithelium. Carcinoma. So let's hit the benign. Benign squamous epithelium. Remember to vision the epithelial cells, how the epidermis and the dermis connect? That papillary that's between them, it has that to increase surface area. So that's the papilloma. Remember, benign for squamous cell is papilloma tumor. And, excuse me, goodness. And then we have squamous cell carcinoma. I was just choked, but I'm okay, you know, just gotta swallow, Rebecca. So we have our papilloma is our benign, and that malignant for epithelium was squamous cell carcinoma. Okay, and there's 3 more. So we have pre-malignant lesions, which is like dysplasia. We know that. The epithelium dysplasia happens in the epithelium. So that's good. Pre-malignant lesions, okay? Which can also include leukoplakia, stuff like that, but we're not going to get into all that. This just states pre-malignant lesions. We know that can happen in there in the epithelium. So tumors of the epithelium, papilloma, squamous cell carcinoma, pre-malignant lesions, okay? And then there's 2 more. We have basal cell carcinoma, happens in the epithelium, squamous epithelium. And then we have varicose, V-E-R-R-U-C-O-U-S, varicose, V-E-R-R-U-C-O-U-S, varicose carcinoma. I'm guessing it's the, like, we know that there's varicose veins underneath our tongue. So those, that's what I think of. So the base of the tongue. So think of the epithelium. We have 2 kinds, papilloma, squamous cell carcinoma, base of the tongue, so basal cell carcinoma, verrucous carcinoma, and then pre-malignant lesions, okay? All right. Oh, papilloma. We know about the papilloma. Papilloma is the benign tumor of the squamous cell epithelium. It's going to be small, exophytic. I'm not sure what that word means, but it is pedunculated or sessile. So we know pedunculated is that nice attached by a stalk like a mushroom, or sessile growth, which is a broad base, because my sister got a broad base, sessile. And then it's often on the soft palate or the tongue, which is pretty, you know, we know papilloma, it's on the tongue. A lot of cancer's on the tongue or the soft palate. And then under a microscope, it's going to be papillary projections. That's pretty self-explanatory. And then it can be treated by surgical excision. So if you have a mushroom growing on your tongue, you want to cut it off, okay? If you have a little papilloma, just cut it off. Cut that sucker off. So surgical excision. Or if it's a sessile base, just chop it off. I'd like to picture more of a mushroom style for the papilloma, because papillaries stick up anyway like that almost. And I would want to cut it off. So, okay. So this says pre-malignant lesion, if left untreated, can develop into cancer. So these are 3 of those pre-malignant lesions that we were talking about in the squamous epithelium, that a tumor can be created, blah, blah. So pre-malignant lesions, if left untreated, that can develop into cancer are, as we stated, 1 is leukoplakia. We have epithelia dysplasia, but there's also erythroplakia. So the pre-malignant lesions that we may see in the oral cavity, 3 of them that can turn into cancer if it's left untreated: leukoplakia, erythroplakia, and dysplasia. They say epithelial dysplasia, but we know dysplasia is in the epithelium, so it's hand in hand. Not too bad, right? This one does have a star on it. So epithelial dysplasia, we know what this is. So epithelial dysplasia typically proceeds into squamous cell carcinoma. So if you see dysplasia, just think it's most likely going to turn into squamous cell carcinoma if left untreated. That's the type of cancer it's going to become. And then changes may revert to normal if the stimulus is taken away. And this may be presented as basically red or white. It could be mixed. So it can be red, white, mixed, dysplasia, epithelial dysplasia. So remember that dysplasia, if somebody's smoking a cigarette and they get dysplasia right here, if they stop smoking and they take that stimulus away, it can go back to normal. If not, it's most likely going to turn into squamous cell carcinoma, right? Because it is epithelial malignant tumor, so squamous cell carcinoma. Not too bad. This has a star. We know this one. Carcinoma in situ. Severe dysplasia involving the full thickness of the epithelium. We know this. Carcinoma is epithelial cancer, right? But carcinoma in situ, it's kind of just situated. The full thickness of the epithelial just waiting to become cancer. It's dysplasia. It is ready to go. Just needs one little ingredient to become malignant. It is severe dysplasia involving the full thickness of the epithelium. Carcinoma in situ. And we know that dysplasia is most likely going to be what? It says carcinoma, so it's going to be a malignant tumor of the epithelium. Not too bad. Squamous cell carcinoma has a star on it. These are really important, but it's pretty repetitive. We go over and over these, so this should be getting a little bit easier. If not, feel free to message me and we will talk through it, okay? So, squamous cell carcinoma. It is the most common primary malignancy in the oral cavity. So this is one that we'll be seeing a lot of, hopefully not, but if we see dysplasia or leukoplakia or anything like that, it can most likely turn into squamous cell carcinoma. So we need to know that. So it says it can infiltrate adjacent tissues and form to distant lymph nodes in the neck, lungs, and liver. Well, we know it's a malignant tumor, so we know that it can metastasize. We know it wants to go other places. We know it's invasive, so that's pretty easy to remember. It's squamous cell carcinoma. We know it's unpredictable. It can do anything it wants to. It can grow fast, grow slow. It can do anything. Metastasize. This says it can infiltrate and destroy bone as well. And it's well differentiated. Well-differentiated tumors will show keratin. Okay, so remember it can be well-differentiated or undifferentiated. We just don't know what's going to happen with malignant tumors, but if it is differentiated, it's going to show keratin and have a keratin pearl in it. Squamous cell carcinoma. So we'll just think of this as, I don't know why, but squamous cell carcinoma, they're little squares. I don't know. For some reason, I'm thinking of the Little Mermaid because I heard pearl now. So keratin pearl. I don't know how we can remember that, but squamous cell carcinoma has a K sound, keratin pearl, squamous cell carcinoma, Little Mermaid, under the sea, in the mouth, just something like that. But just remember, it's really invasive. It can do anything it wants to. It's the most common malignancy in the oral cavity. It's primary, so it will metastasize and cause secondary tumors in other places, like the neck, lungs, liver. Okay, it can destroy bone. Bone's hard, pearl's hard. Little Mermaid, she's awesome. She goes hard. Okay, so keratin pearl, you can see in the differentiated tumors of squamous cell carcinoma, but they can also be undifferentiated. We just never know. No star on this, but just in case, solar cheilitis. I don't know if I said that right. But this is awesome. Not awesome, but this is solar. Think of sun, of course. And what do we want to do with the sun? We want to avoid the sun, and we want a sun-blocking agent, right? So this is a condition in which mild to severe epithelial dysplasia occurs. So, okay, so solar cheilitis, we want to shield ourselves from the sun, okay? Shield from the sun because it's mild to severe. dysplasia. So just think of your lips burning, chapping in the sun, and it's dysplasia. It's looking a little funky. It's red, white, maybe a mix of the both. Okay? So it's a condition that you want to avoid the sun, shield from the sun. Excuse me, I've got hiccups. Goodness, choking. We're going to get through this though. So this says tumors of soft tissue. Well, okay. So soft tissue, okay. So we have lipoma. Lipoma, we know fat is soft, okay? Fat is soft, okay? Fat is super soft. Lipoma, we know is benign of the fat cells, the mature fat cells. We have tumors of nerve tissue, tumors of muscle, and vascular tumors. So, tumors of soft tissue, how can we remember this? Well, we'll just think soft tissue, fat is soft, okay? Fat is soft. The rest is nerve, muscle, and vascular. So, I'm going to make up a saying, okay? So, tumors of soft tissue. We have lipoma. Lipoma's, it's fat, it's soft. And then I'm just going to think, but the nerve of that muscular guy in here, coming in here with those muscles, the nerve of him, all them vascular, he must be on steroids. He's got all them veins showing, vascular. The nerve of that muscular, vascular person to come in here with my chunky little self, or something like that, okay? I know that sounds silly, but tumors of soft tissue. Well, fat is soft, but the nerve of that muscular, vascular person, man, he shouldn't be coming in here showing all that off, or something like that. So if you can remember that, tumors of soft tissue, you remember that it has lipoma, because that's fat. You have nerve tissue, tumors of muscle, and tumors of vascular tumors. Okay, so soft tissue, okay? Fat is soft. I'm a little soft. And the nerve of that muscular, vascular person coming in here. Okay? Got it. Okay. Tumors of nerve tissue and others. Well, that's pretty bland. There is a star on this. There's a star. Okay, so let's get it. So tumors of nerve tissue and others. So many others. Okay, this is not too bad. So nerve tissue, we know this. Okay, so nerves, neurofibroma, okay, that sounds pretty benign, but I could be wrong about that. Neurofibroma and schwannoma, okay, that's easy. Schwann cells in the nerve cell, okay, so neurofibroma and schwannoma, okay, and then we have a granular cell tumor and congenital epulis. I'm not sure how to remember this. However, I think congenital epulis is actually another card. So once we understand exactly what that is, maybe it'll be a little bit easier, because it just says tumors of nerve tissue and others. So that kind of is very vague. Oh my Lord, cannot talk. Okay, so tumors of nerve tissue, neurofibroma and schwannoma. Okay, granular cell tumors and congenital epulis. Congenital, I think of like being born with. So we can think of this. So nerve tissues and others. Nerve tissues. So we are born with great nerves. Okay, that's pretty lame, but we are born with, so congenital epulis, granular cell tumor, and neurofibroma and schwannoma. We'll come back to this. I think there's cards about these, so we'll kind of get a better grasp of those. Okay, ready? This is there's a star, so it's the neurofibroma and schwannoma. Yes, they are benign tumors derived from Schwann cells in nerve tissue. So that's easy. So neurofibroma obviously has the oma, so we know it's benign. We can work through that. And schwannoma, we know is Schwann cells in the nerve cell, so we can work through that. And the tongue is the most common intraoral location. So that's easy, okay? The tongue is usually the most prominent place for cancer. So we know neurofibroma and schwannoma, benign tumors derived from Schwann cells in nerve tissue. Okay, that's pretty easy. We kind of got that. Okay, here's granular cell tumor, and there's a star on here. Granular cell tumor. A benign tumor composed of large cells with a granular cytoplasm. Excuse me. Okay, well, that was pretty self-explanatory. A granular cell tumor is a benign tumor composed of large cells with a granular cytoplasm. So granular cytoplasm, large cell. Pretty easy, right? Granular cytoplasm, large cell. Okay, it occurs on the tongue or buccal mucosa. Well, don't they all, right? So granular cell tumor is a tumor that has a granular cytoplasm and large cells. Okay, pretty easy. That was nice. We got that. Here we go. Congenital epulus. There is a star. Let's find out what this is. Okay, this is nice. This is going to be good. So congenital epulus, a benign neoplasm, aka tumor, a benign tumor that most likely arises from primitive mesenchymal cells. I don't know if I said that right, but we are familiar with mesenchymal cells. So those are the cells like stem cells when we're born. We went through all of the embryonic stages and stuff like that. So these cells actually can make anything you need it to make. They send certain little chemical messages to them like, hey, we need more ameloblasts. Can you make some more ameloblasts? And they turn into ameloblasts, just like stem cells. If you needed something else, bone marrow or something, maybe they can turn into bone marrow. I don't know if that's how it works exactly, but that's the kind of comprehension I'm getting from this. So congenital, born with, like it's the beginning, in my opinion, it's like congenital epulus. So mesenchymal cells are kind of like a born, they could be born to be anything. Congenital mesenchymal, okay, mesenchymal. I'll just spell it out because I don't think I'm saying it right. So mesenchymal. So mesenchymal cells. Congenital epulus mesenchymal cells. Okay. It can be sessile or pedunculated, mostly anterior maxillary gingiva. So up top. So all I want for Christmas is my 2 front teeth. That's like, I know that's silly, but I think of that being the first 2 teeth, okay? That's the first 2 you lose, so we'll just think up top, congenital, born with congenital, first 2 teeth. All I want for Christmas is my 2 front teeth. Congenital happens up here, okay? Can be sessile or pedunculated. And yeah, so that's beautiful. The beginning, congenital, mesenchymal cells. All right. Hemangioma. We went over this before. Let's review. So we're looking at HEM. Yep, exactly. So that reminds me of the blood. Remember, like hematoma, stuff like that. And it is oma, so hemangioma. And angio was what? Vessels and stuff like that. So blood vessel tumor. Now this says a benign proliferation of capillaries. So proliferation is growth. So a benign growth of capillaries. Hemangioma. So that's going to be your blood vessel benign tumor. Okay. That's not too bad. Only a few more to go, so not too bad. And we'll be fully ready. All we'll need to do is staging. That's its own video. Okay, so this says malignant vascular tumors include. All right, this is start. Are you ready for this one? Malignant vascular tumors include. Well, we know that there are blood vessels that have malignants and the lymph vessels that have malignants and stuff like that, which are sarcomas because they're down below the connective tissue. Anything down there is pretty much sarcoma. So we're looking at a sarcoma here. But this one, when it says malignant vascular tumors include, I'm looking for 2. So Kaposi sarcoma, remember that has to do with herpes 8, I think. So Kaposi sarcoma and HIV, okay? HIV is not really a cancer, so I don't really know why this is here, but it starred and it was on the PowerPoint. So malignant vascular tumors include, so not just the lymphangiosarcoma, and the other one was it was like hemangioma sarcoma, something like that. Oh my goodness. No, I think it was just angiosarcoma for blood vessels. Yep. Angiosarcoma for blood vessels. And then lymphoangiosarcoma for lymph vessels. Did I say that right? Blood vessels, lymph vessels. And then in addition to those, okay, so we have Kaposi sarcoma and HIV. So think malignant, bad vascular stuff. So if you get hurt, I know, I'm sorry. Some people do have herpes and HIV, so I'm not making fun of it. This is study purposes. So Kaposi sarcoma, which is a herpes 8 strand, and then HIV, okay, in multiple sites. And they include the skin and oral mucosa. We know this. We know where you can get herpes at, okay? Not just the mouth, if you know what I mean, which would be on skin somewhere. Okay, so the next one, this says melanotic nevi, which is another fancy term for nevus. There's a star there. Now, yep, so nevus, so this was an exception of the neuroectoderm. So we remember the ectoderm being the outside of the skin, right? What do we have on the outside of our skin? Beautiful melanin. So melanin, so where's the origin from? Origin. Melanocytes, right? So nevus was that malignant, because that word was so weird, right? It was neuroectoderm, and it was an exception, you know. Melanoma was the malignant, and that's almost typically benign, but that one's malignant. The whole word was just so off. It was such an exception. So neuro really wasn't about the brain or anything like that. It was the nevus. That's the benign version of that. So this definition is developmental tumor of melanocytes or a pigmented congenital lesion. That makes sense. Melanotic nevi is also nevus. Nevus, potato, okay? Melanotic, and that's kind of in there, melanotic, so melanocytes, okay? That one's easy. We got that. This is starred, and we have this one as well. Malignant melanoma. We know what that is. Malignant tumor of melanocytes. It's a skin response to long exposure to sunlight, may metastasize to oral cavity. So if you get melanoma, it can metastasize and travel to your oral cavity. That's all we need to know about that. Malignant tumor of melanocytes, okay? Leukemia. There's a star. Leukemia. A broad group of disorders characterized by an overpopulation of atypical white blood cells. Leukemia. So we know leuco, that is white, right? So we know we're dealing with white blood cells. So leukemia is an overproduction of atypical white blood cells. Okay, think of when you have an infection or anything, your white blood cells are going to elevate, stuff like that. So when you have leukemia, you're trying to fight off an infection in your blood or wherever it may be. So leukemia is an overpopulation of atypical white blood cells. Okay, 3 more to go. Lymphoma. This one is starred. Lymphoma sounds like it would be a benign lymphatic tumor, but we know it's not because we know that is lymphangioma. So this happens to be an exception. So this says non-Hodgkin lymphoma. So lymphoma, this one word is an exception. So don't get confused when you see lymphoma. Do not think it's a benign lymph vessel because of the word vessel, you have to have angio in it, okay? Lymph vessel. So lymphangioma, okay, would be the benign of that. And then lymphangiocarcinoma, because that's the malignancy of connective tissues. So this lymphoma is a malignant tumor of lymphoid tissue, not the vessels, lymphoid tissue, mainly the tonsils. Non-Hodgkin's lymphoma is malignant of the tonsils, okay? Lymphoid tissue. And we know our tonsils are lymphoid tissue, okay? They are. They help fight infection. So non-Hodgkin lymphoma, Malignant tumor of lymphoid tissue, not the vessels. It's the tissue. Okay. Hopefully he uses non-Hodgkin's lymphoma, because that kind of gives you that where you can separate it from others, like non-Hodgkin's. That one stood out. That's really bad. You hear about that, and it's, it's not good. Malignant tumor of lymphoid tissue, mainly tonsils. Okay. Multiple myeloma. We've heard this one. There's a star. Multiple myeloma, systemic malignant proliferation of plasma cells. That's why there's immunoglobulins involved. They're not on this card, but we know some of our other terms happens to have immunoglobulins, and it does talk about plasma cells and multiple myeloma. So multiple myeloma, we know, is another exception, myeloma. So it's a malignant growth of plasma cells. Multiple myeloma. Causes destruction lesions in bones. Bone pain and swelling is involved. So myeloma. My leg hurts. That's what I think of. My leg hurts. My bone in my leg is hurting, swelling. Multiple myeloma. So bone marrow, right? So I think bone marrow kind of reminds me of plasma cells, maybe. I don't know if you can, blood comes from bone marrow, right? Blood cells, possibly, maybe, bone marrow. So plasma cells are also included in that. So if we think multiple my leg hurts, we know that it's bone pain, swelling, bone lesions, destruction in the bone. It's malignant growth of plasma cells, okay? Okay, multiple myeloma. Multiple my leg hurts. I have bone swelling, pain, really bad, really malignant, really bad, of the plasma cells. Bone marrow, so makes the blood cells, so plasma cells, okay? Last one. Okay, this one says Langerhans cell histiocytosis. Okay, there's a star on this. Sorry, I don't know why I keep coughing. So this one, when we looked on the PowerPoint, was a panoramic x-ray, and it looked like periodontal disease. It looked like the bone was almost gone. So a lot of times this right here gets confused with periodontal disease or endodontic treatment and stuff like that. But this is Langerhans cell histiocytosis, okay? It is a Langerhans cell disease, group of rare disorders characterized by presence of histiocyte-like cysts and eosinophils. Okay? Jaw lesions closely mimic periodontal disease and or endodontic disease. Okay? This diagnosis is considered when a clear odontogenic etiology, I don't know if I say it right, etiology, cannot be identified. So typically this right here, just kind of study the name of it, Langerhans cell histiocytosis. So let's see. So history, if we cannot find a actual cause of this, if it's not periodontal disease and it's not endodontic, like we don't know where it's coming from, it's history, we just don't know where it's coming from, we can diagnose the bone loss as Langerhans cell histiocytosis. Okay, I hope that helps. And that was all of them. So that was the last minute quick review for tomorrow's test. That was the second PowerPoint of Neoplasia. I hope it helps. Let's get it. All we have to do is stage now. So we got this though. Just take a quick peek at that. I may make a video, but the test is tomorrow. So study, study, study. I hope this helps. Just review, and I will see you guys tomorrow. See ya. Thank you.